Welcome to Beverly Hills Regenerative Medicine. We are a team of physician scientists who started this practice to bring the latest science to our community. Here we aim to address questions regarding the latest on COVID-19 testing. What are the different tests available for the virus causing COVID-19? 1. A diagnostic antigen test. This test detects virus particles present in the specimen. A specimen is typically collected from the nose and then analyzed. This test typically takes 20 minutes to result. This is the test that lets you know if you currently have the virus. 2. A PCR test. This test looks for the virus's DNA present in the specimen and copies them hundreds of times if present. Because it amplifies DNA that may present in tiny amounts. It is a very sensitive test, meaning if it is negative, you can be sure you do not have the virus that causes COVID-19. This test can take 24 to 48 hours. This test also lets you know if you currently have the virus. 3. An antibody test. When your body is exposed to a virus, it detects it as a foreign invader and it makes antibodies to flag the virus as foreign. Objects flagged with antibodies are then sorted and destroyed by the immune system. There are two types of antibodies. IgM is what the body produces in an acute infection by a virus never seen before. This can take hours to days once the virus is in the body. After about 2 weeks, the body then makes IgG antibodies, which can produce long-term immunity, meaning if the body is attacked with the same virus again, IgG antibodies will immediately flag the virus particles as foreign for destruction. If your test results show that you have the antibodies for the virus, there is an assumption that at some point you previously had the virus. This test does not tell you whether you currently do or do not have the virus. To recap, the antigen and the PCR test will tell you whether or not you have an active infection, regardless of whether you have symptoms. The antibody test will tell you whether you have been exposed to the virus and have developed some immunity to it. It is important to know that influenza and COVID-19 share some similar symptoms, and for this reason, it may be difficult to tell whether you're sick with the flu or have COVID-19. If you have symptoms, we recommend you get tested for both COVID-19 and the flu, because with early detection, we can prescribe you flu medication to shorten the duration of your symptoms. Many people with COVID-19 can be asymptomatic. However, we recommend everyone, whether symptomatic or not, get tested for COVID-19 on a regular basis to ensure safer interactions with our loved ones.